Hello, good morning, Professor Allanore. Professor Allanore is full professor of rheumatology at Cochin Hospital in Paris. So I would like you to tell us what are the evidences for the use of MMF in systemic sclerosis on ILD.
So thank you very much, and I think it's interesting to cover this area following the nice discussions we had during the ILD symposium. So regarding the use of MMF, we have quite robust evidences. The first one came from the SLS2 study, in which 2 years of MMF was compared to 1 year of cyclophosphamide, and it showed that the outcomes were similar, but the safety profile was much better for the group of patients receiving mycophenolate mofetil. It was true for FVC, for these patients having interstitial lung disease, but it was also true regarding the skin score and the trajectory of the modified Rodnan skin score. And it was interesting to see that patients receiving MMF in SLS2 had better outcomes than patients receiving placebo in the SLS1 study. Then we have several other, I would say, less indirect data, like the observational data from the ESOS cohort that showed some effect regarding MRSS. Specifically regarding ILD, we have, of course, the Census trial, in which it was shown that the best scenario was open for the patient that received concomitantly nintedanib and mycophenolate mofetil, and this is now opening the door to future projects looking at the potential combination therapy. And we have also the very recent data from the Corbus trial, lenabasum, that showed that the patients who had the best preservation of FVC were those receiving MMF, and also that the patient who received early MMF had a good trajectory also regarding the skin, with a largest reduction regarding the MRSS. So we have quite large evidences, even if there is no direct phase 3 clinical trial demonstrating its effect, but all these data support what has been recently shown, particularly at the ACR meeting, that is usually MMF is seen by the physicians as a first-line treatment for Ssc-ILD and also probably for early diffuse cutaneous systemic sclerosis patients.
Okay, thank you very much, Professor Allanore, for your interview and the participation at the ILD symposium held in February. Thank you very much, Professor.
For the invitation.
Okay.